Hey guys, Dr. Ray Marquez here, your local chiropractor at Back Pain Relief Center. I'm here with my wife Julie. She's about to go to the gym. Her neck and back's been bothering her a little bit, so we're going to get her fixed up, get her adjusted, a little manual therapy, and get her able to function and feel a little better. So a big thing that we do here that's different from some other offices, on top of the spinal manipulation, we also do some soft tissue work. We stretch them out a little bit. This way we can get the whole body functioning correctly. All right, so first thing I'm going to do is I'm going to lay on your back. So first we're going to stretch her legs out, try to even out her pelvis, loosen the leg muscles. This way her low back functions a little more at ease. Julie's pretty limber, so we don't have to go too aggressive with it. Some people are really tight and we got to do a little work. Matter of fact, some patients, we can't even manipulate them. We got to do all soft tissue work before we even get to the spinal manipulation. That's okay, because that's all part of getting you to feel better. We worry about our legs a lot because all the leg muscles connect into the pelvis, and if there's an imbalance or there's tightness or there's adhesions, they can make the pelvis misalign, dysfunction, and affect the low back. Next, we're going to stretch your neck out a little bit. About half of my patients love getting their neck adjusted. The other half hate it. So for all you out there that have difficulty or don't like getting your neck adjusted, we can go through ranges of motion with stretching, use some instruments to loosen it up to get it to feel better. We don't necessarily need to do the manipulation. Okay, come on up. Then we're going to go to your stomach. When I treat my patients, I use a number of instruments. The first one I use is a Pro Adjuster, and what that's doing is just vibrating each joint, breaking up any adhesions or scar tissue, realigning the vertebra. I use this a lot on patients that don't like to be manually manipulated. We can do the same job, get everything working, decompress the joints. This instrument here is just a good old massager. We do it for a myofascial release to loosen the muscles up, get rid of any trigger points, allows the adjustment to go easier, and for her hold her adjustment or alignment longer. Again, if you're worried about getting manually manipulated, this is a tool that we'll use on you. We do have a laser. I don't need to use that on her today, but it's a high frequency laser that we use on patients that are in severe pain. If she had acute low back pain, maybe radiating down to the legs, or some trigger points up in her neck that were causing her some discomfort, we'll use a laser. It's a lot like an ultrasound. Creates more blood flow, breaks up scar tissue, gets you to feel a little better. Now I'm going to have you lay on your side, face me. The next thing we're going to do is a side posture adjustment. It's going to realign her lumbar spine and her pelvis. Good, the other side. So Julie, I've been adjusting her for quite a while. We do a spinal manipulation or mobilization of the cervical vertebra. She responds well to it. Again, we don't have to do it, but she responds well to it. Okay, come on up. We're going to sit on the edge here, face this way. Next, we're going to do a thoracic manipulation or a thoracic release. Relieves a lot of that upper back pressure that you might be having. If you're working on the computer all day, on your cell phone a lot of people get that upper back tension. Back down. And we do that all the way down to the mid-back. Let's go back on your stomach for me. I wasn't pleased with how her neck moves, so we're going to do it when she lays on her stomach. This will hold a little better. Good. Good. And then we're going to end off a little more myofascial release. Next, what we do after this, which we don't have time for the video, we would do some electric stim and heat on our upper back and low back to loosen everything up. that'll really get things moving well, get some blood flow there, gives you more range of motion, gets you to function and feel better. After this, we would put her on our roller bed. Our roller bed does intersegmental traction, really creating a lot of motion in that back. This is the way you can move around and do the things you like to do. Come on up. Face that way. Okay, so we're all done now. Joe's gonna head over to the gym, work on her fitness a little bit. And if you have any questions, please message me, email me, you can even call me, and I'd love to talk to you. Have a great day, and we'll talk to you soon.